Okay, so we're going to talk about multiple myeloma and peripheral neuropathy. And I'm Dr. Martin Rutherford. I'm a certified functional medicine practitioner. This is Dr. Randall Gates.
I'm a board-certified chiropractic neurologist.
And together we have married the disciplines of the brain and the nervous system, along with functional medicine, relative to the abnormalities of the metabolic system, to ultimately treat chronic pain and chronic diseases. And we don't treat cancer, but we do treat peripheral neuropathy. And we treat a lot of peripheral neuropathy. We kind of allowed our practice to develop on its own, and in the end, it developed that a lot of people out there have peripheral neuropathy, and they're a very effective means of helping those of you who have peripheral neuropathy, who have been told nothing can be done for you. For the vast majority of you, the disease can be, or the condition can be stopped, and it can be reversed. And in many cases, it can be substantially improved, some cases moderately improved, and so on and so forth. So we're going to, and in the medical model, and again, Dr. Gates just feels more comfortable when I say this, and he's probably right. We're not anti-medicine. We work with medical doctors when we need to. But in the medical model, it's pretty much, you have peripheral neuropathy, it's diabetes, it's your neck, it's your low back, it's your ankles, it's post-chemo, or we don't know what it is. And there's about 80 different reasons that you can develop peripheral neuropathy, which we'll define, and multiple myeloma is one of them. So that's what we're going to talk about. So peripheral neuropathy, pain, numbness, tingling, burning, aching. Peripheral means your peripheral nervous system, so your brain and your spinal cord is your central nervous system. And then everything outside of that is basically your peripheral nervous system. And mainly we're talking about your feet and your hands, in essence. Experiencing these pains, numbness, tingling, cramping, sharp shooting pains. The gentleman the other day felt like his feet were swollen, and so on and so forth, a variety of different symptoms. But multiple myeloma, that's a whole other animal. And right. I'm going to start to defer to my colleague, Dr. Gates, on this. He is the one who is more conversant in this, frankly, than I am, and so I'll let him kind of go from there.
So for those of you watching out there, obviously you know what multiple myeloma is. It's a type of bone cancer. It can be a very serious condition, to say the least, and so many of you have been basically treated with chemotherapy. Velcade is the most common that is associated with multiple myeloma and peripheral neuropathy. We have seen cases of Velcade-induced peripheral neuropathy in myeloma patients. And the neat part about our programs is that we look to see, can someone get better with our treatment modality? Right. So we had one case where the guy came in and literally he was better in 4 visits. And we had another case where the neuropathy was a little more severe. The gentleman was on Velcade for a longer period of time and we couldn't help him.
I think what Dr. Gates is referring to is we do kind of a screening process because there are people who can't be helped by these types of procedures, and that's what he's presenting. So we do a fairly significant screening process before we make the decision as to whether to recommend this type of treatment to the patient or not. We don't recommend them. We don't recommend our treatment to everybody, but we've got pretty good results with them.
We have
with these cases.
And we've treated a lot of other chemotherapy-induced peripheral neuropathy. Right. Just here we're talking about multiple myeloma because we had a patient who has a relative who has this, so we wanted to touch on this. Multiple myeloma by itself can result in peripheral neuropathy. About 5% of multiple myeloma cases get neuropathy just because of the cancer. There's something called a monoclonal gammopathy of uncertain significance, which causes a similar immune system response as multiple myeloma, but it doesn't result in multiple myeloma, but it results in neuropathy. And we talked about that last week, and we've treated a lot of those cases. But it seems as though 5% of multiple myeloma cases do result in neuropathy due to the immune system not only having problems with the cancer, but also having problems with the peripheral nerves. And what we wanted to talk about relative to the chemotherapy-induced peripheral neuropathy topic is that sometimes you eliminate the chemotherapy and the neuropathy will go away. A lot of oncologists will say that 80% of our cases, they'll come back in a year. If it doesn't come back in a year, meaning your symptoms regressing, then you're probably going to have to live with it forever. We have not found that necessarily to be true. And we've actually worked with a lot of patients whose oncologists were very much in favor of what we were doing because if it could help their patients, why not? And in essence, what we do is we look at the underlying metabolic factors that may have been disturbed by the chemotherapy now that the cancer is gone, certain vitamin deficiencies, things of that nature, a lot of oxidation. But we also try to rehabilitate the nerves. So the nerves were damaged by the chemotherapy or let's say the cancer, and those nerves are not functioning right. They're like a destroyed muscle. And what we do is we go in there and basically start working those nerves, causing them to function better by stimulating them. And that can result in a person's symptoms really improving. But as we said, it's not something that we just have a blanket cure for. We look at each patient individually, seeing if we can help them or not.
And for those of you who might, for example, have already talked to your doctor, or maybe you've seen something relative to these different stimulations or different types of stimulations that can be used. It's not one stimulation for every different type of patient. One might be a certain type of, like something called a rebuilder, another one might be an interferential current, another might be a Russian stem. And your doctor might say, well, I've heard about that, but it's only temporary, so you're just wasting your time. It is only temporary if you don't correct the underlying nutritional deficiencies or inflammatory mechanisms or oxidative mechanisms that Dr. Gates just referred to. So you kind of have to put the two together for you to get a reversal of your situation. As Dr. Gates has used the analogy, it's kind of like defibrillating a heart and getting it to start working again. But if all the things that happen, whatever happened to cause that person to need their heart defibrillated happens again, if that's not eliminated, then then you're going to have it happen again. It's the same thing with your feet. That chemo is pretty aggressive, and it changes a lot of things in your system.
And that is why we're writing a book on peripheral neuropathy, because we've observed just awesome changes across the board with many different types of neuropathy, and we want the scientific community as well as patients suffering out there to know about these results. And we are actually establishing a new webpage called peripheralneuropathygroup.com, where we have scores of videos now. Well, not scores, we have dozens of videos on peripheral neuropathy. They're going to be posted there so you can get more information on this type of neuropathy or other types of peripheral neuropathy and how we really go about treating them. So I would say that's what we have to say about that.
Okay, hope that's helpful. If you have any questions, you want any further information, refer to the website. Or if you have specific questions, you can refer them to Dr. Gates on powerhealthtalk.com or
our Facebook page.
and you will get an answer.
Thank you for watching.